Mother's Day is just around the corner, so Dr. Travis and Dr. Frida Lewis Hall, the Chief Patient Officer of Pfizer, are going to let everyone know some suggested health questions that they should ask their own mothers.
Dr. Frida, great to be with you here in New York City, talking about something so important because it's almost Mother's Day and half your genes are from mom. So today we want to encourage each and every one of you to ask your mom questions about her health. You know who's a mom and also a grandma?
That would be me.
That would be you. So explain why everyone, especially women, need to be proactive about understanding their family's health history.
Well, the fact is that knowing your full family health history is important to your health. Because if your mother or other immediate family members have certain medical conditions, you may be at greater risk for developing those same diseases.
And your family history may help you learn what steps are necessary to prevent certain illnesses and health problems. And having a solid knowledge of your family's health history can also help you detect illness at an earlier stage, which of course can make lifestyle modifications and medical treatments more effective. First thing we're going to talk about, because we should, is heart disease. The risk of heart disease and its risk factors are strongly linked to family history.
Well, that's a great place to start because it's especially important for women to know their family's heart health history. Why? Because heart disease is the #1 cause of death of women in the United States. And almost 2/3 of women who die suddenly of heart disease have no previous symptoms. So, ask your mother, do you have high blood pressure? Do you have high cholesterol? Do you have any heart issues that I don't know about? And it's especially important to ask if you have a family history of early heart disease. So be sure to ask your mother if she had a heart attack before the age of 65.
And if your mother says yes, that's important because if your mom has a history of early heart disease, you may be more likely to get heart disease yourself. Your doctor will need to keep an eye on your heart health in order to lower your risk. But heart disease, we know, not the only medical topic that you need to broach with mom. Certain types of breast and ovarian cancers can also be passed down through families. If there's a family history, you and your doctor may decide that genetic counseling and testing should be done. So ask your mom, have you ever had an abnormal mammogram or maybe an abnormal breast biopsy? Have you ever been diagnosed with cancer? If so, how old were you when you were diagnosed?
And if you can't speak with your mom, ask another family member about your medical history as much as they know. And then what you learn, share with your doctor right away. So being a female can also put you at risk of developing osteoporosis, which can cause bones to become weak and brittle.
And in some severe cases, even coughing or a simple action like bending over can result in a break. One reason why women are more likely than men to get osteoporosis is that estrogen, that's a hormone, of course, that can protect bones. It decreases sharply once a woman reaches menopause. That can cause bone loss. 1 in 2 women over the age of 50 will break a bone because of osteoporosis. Staggering statistics, 1 in 2 women. And many people with osteoporosis don't even know they have it until they break a bone. If you have a parent who has a broken hip, you could be at increased risk.
So you have to ask your mom, okay, Mom, have you ever had back pain or have you lost height or had changes in your posture recently? And of course, you want to ask straight out, have you ever broken or fractured a bone?
Let's switch gears and get to another important question for mom.
I'm 8 months pregnant and I've heard postpartum depression is common. Is this something I should be concerned about?
Definitely, it's really important to ask your mother questions like, what was your pregnancy like? And did you have symptoms of postpartum depression? Now, it is very common for women after the birth of their baby to feel sad and anxious and tired. But if it becomes so severe that it becomes difficult to take care of themselves or others, this may be postpartum depression.
Some research has shown that genetics may play a role when it comes to postpartum depression. If your mom suffered from it, speak with your doctor and he or she can put a plan in place to proactively manage it should you experience it as well.
Now, okay, understandably there are some things that are difficult for you and your mom to have a conversation about. But the more questions you ask your mother, and your dad as well, the better off you are at having a full medical history. You may learn things that are important to your health or the health of your children. Now, there's lots to know, lots of questions to ask your mother. So on GetHealthyStayHealthy.com, we have a women's health checklist, and you'll also find there questions about different topics that you may want to ask your mother, like menopause. And of course, while you're there, you can sign up for our monthly newsletter.
Happy early Mother's Day.
No, thank you.
Stay tuned. We'll be right back.